Addiction. A vicious cycle. As American writer Mark Twain once said, "Quitting smoking is easy. I have already done it thousands of times." This quote, although it appears humorous in the first instance, also sheds light on the darker and difficult sides to set oneself free from addiction. So what does addiction mean exactly? There are so many ways in which it could be defined. To make it easy to understand, addiction essentially means a repetitive consumption of any substance which affects the functioning of the mind in an adverse manner. Despite the knowledge about its adverse effects, a person continues to consume the substance which dominates all other priorities in life, like family, job, society, etc. The person struggling with an addiction feels trapped in a vicious cycle and needs a lot of help and support to get out. The term addiction also includes non-chemical aspects and behaviors, such as in the case of gambling, internet, mobile phones, etc. Addiction is one of the most common issues society has faced for ages. However, very little has been done by society as a whole to deal with it. According to the National Drug Use Survey report in 2019, around 25 million, or 2.5 crore Indians in the age group 10 years to 75 years have dependence on alcohol. This roughly comes to 2.7% of the total population of India. Moreover, approximately 57 million, or 5.7 crore Indians, are considered problem users of alcohol in India. Lack of knowledge about addiction amongst the general population often leads to myths, and hence it remains one of the most rampant issues, but yet under-addressed on most of the occasions. So let's start this conversation with a clean slate. First and most important point, addiction is a mental health issue. It is a long-standing problem and can return back even after long periods of abstinence. For a person addicted to a particular substance, searching, consuming, and remaining under its influence becomes the priority in life. These points are also the cardinal features of this illness. Continuous consumption of substances over a period of time leads to tolerance. This means that gradually, in the future, an individual will have to use more substance to experience the same desired effect. This evolves into dependence, and when they try to reduce the consumption, the person experiences withdrawal effects. In clinical settings, many patients struggle to abstain from the consumption of such substances as they are not able to face these withdrawal symptoms. With the help of medicines, a patient can be helped to deal with these withdrawal symptoms and also can be helped to overcome the craving to consume the substance. Medication can be supplemented by counseling, which is also a very important part of the treatment. Support groups like Alcoholics Anonymous and more also play an essential role in the treatment alongside the interventions mentioned before. Crucially, the support from family and friends are the backbone of the treatment. Remember, a person struggling with addiction problems at some stage wants to quit, but simply doesn't know how to quit. Informative videos like these can help spread awareness about this illness and its treatment. There are chances that a person can experience a relapse after a period of abstinence. However, the key is to increase the duration of the substance-free period between two such episodes. We hope that you find this video useful, and we appreciate you sharing this with others. We welcome your feedback and most importantly your questions and comments. Do encourage us by subscribing to our channel, and thank you for watching. Our special thanks to Dr. Kumar Kamble, who works as a psychiatrist in Nagpur in India, for being the writer of this video.